Greetings, DAC 1319 students. Today we're going to be reviewing Chapter 14, the Under-Recognized Problem of Steroid Misuses. And the objectives for today's lecture are to understand the medical uses of anabolic steroids and the scope of the problem of misuse, and to comprehend the pharmacology and methods of use along with the hazard of misusing steroids. So we begin with that anabolic steroids are Class C drugs which can only be sold by pharmacists with a prescription. So anabolic androgenic steroids are synthetic. That means they're man-made, and they're variations of the male sex hormone testosterone, and they're used to promote the growth of muscle. So anabolic steroid misuse reflects two different social diseases. First, the first disease that we encounter steroid use in emphasizes the physical appearance. So 80% of individuals using steroids are men who are focused on physical enhancement. The second social disease that we're looking at is competitive athletes who find it acceptable to win at any cost. And 95% of professional football players and 80 to 90% of other professional athletes use anabolic steroids to enhance their performance. And so we go into a little bit of vocabulary here, which is called the terminology. So the term anabolic refers to the ability of these compounds to increase the speed of tissue growth or repair. The term steroid refers to the fact that these compounds are structurally similar to testosterone, which is a primary male sex hormone. And the term androgenic refers to steroids due to chemical structures similar to testosterone, it refers to steroids having a masculizing effect on the user. In other words, there's muscular growth and secondary sex characteristics that are going to be emerging with the use of them. So anabolic steroids are usually injected into the muscle or taken by mouth as tablets, but they also come in the form of creams or gels, and they are applied to the skin. So the doses may be 10 to 100 times higher than the doses prescribed to treat medical conditions. So under medical supervision, prescribed steroids can be used for many reasons. One would be to stimulate appetite. Another would be to treat inflammation. Another one to grow bones or to treat cancer or induce male puberty. They're used when children are going through adolescence or going into puberty to achieve adolescence, and there seems to be a delay in their growth. So they use them in this instant. And it's also used as an adjunct treatment to certain forms of breast cancer. It's used to promote bone tissue, like in cases of osteoporosis or where there's been severe injuries where there's shattered bones. And it treats age-related tissue loss. And corticosteroids are close chemical cousins and are used by physicians to suppress the immune system and or inflammation. So cortisone or prednisone, as probably you know it, are anti-inflammatory or immunosuppressants used in swelling, rashes, asthma, or bronchitis. So in the scope of anabolic steroid problems, Most anabolic steroids used in the US are obtained from illicit sources, usually from outside the US. Now, quote unquote, the internet pharmacies are an increasing problem source of obtaining anabolic steroids in the US. There is often an informal distribution network involving persons of health clubs or gyms. In the US, at least 59% compounds have been identified as anabolic steroids by law enforcement officials. Their use of non-medical purposes or the sale without a license to possess or distribute steroids is a crime punishable by a prison term. The medium age for anabolic steroid use is 18 years of age, and research shows the typical user of steroids is male, well-educated, Caucasian, 30 years old, and holds a white-collar job. Although in some instances, the majority of people who misuse steroids are male weightlifters in their 20s or 30s or 30s. And oral steroids are easier to take but have a shorter half-life and are more toxic in the liver. Those who use steroids often combine oral and injected versions. So anabolic refers to muscle building, and androgenic refers to the increase in male sex characteristics. So in looking at the pharmacology, both sexes, androgynous testosterone is involved in a number of body system regulation activities. In the brain, the androgynous steroids molecules modulate the action of the GABA receptor, altering users' emotions found in the brain region involving the area of aggression response, anxiety, and reproduction. Individuals misusing steroids have been found to experience a wide range of behavioral problems and can cause psychological or emotional effects such as aggression behavior, mood swings, paranoia, manic behavior, hallucinations, and delusions. And so even though anabolic steroids do not cause the same high as other drugs, they can lead to a substance use disorder. A substance use disorder, remember, occurs when a person continues to misuse steroids even though there is a serious consequence for doing so. So research has found that since steroid users turn to other drugs such as opioids to reduce sleep problems and irritability caused by the steroids, this even complicates the problem more. So anabolic steroids are addictive, and coming off anabolic steroids suddenly can result in withdrawal symptoms that include depression, apathy, anxiety, insomnia, anorexia, and difficulty in concentrating, and muscle and joint pain. And in our last slide, anabolic steroid misuse might lead to serious, even permanent health problems such as kidney problems or kidney failure, liver damage and liver tumors, enlarged heart, high blood pressure, and changes in blood cholesterol, all of which increase the risk of stroke and heart attack, even among young people who use them. So in men, effects can include reduced sperm count, infertility, erectile dysfunction, baldness, breast development, severe acne, and increased risk of prostate cancer. In women, the effects can include facial hair growth and body hair, loss of interest, loss of breast, problems with menstruation periods, hair loss, and the deepening of the voice. And these are only some examples of the reproductive system problems in men and women. In the liver, kidneys, and digestive system problems, liver the biggest problem are liver tumors and kidney failure. And in the cardiovascular system problems, the biggest concern are early heart attacks and strokes. And as far as the central nervous system problems, the biggest problems are psychiatric problems or behavioral problems that result of the misuse of steroids. And injecting steroids increases the risk of blood-borne infections and severe acne, especially across the back, results. And steroid medications interact. Risk potential is high, particularly with anabuse and acetaminophen, which are like Tylenol and anticonvulsants and more. That concludes our lecture on steroids. Thanks for listening.